नमो भगवते वासुदेवाय धन्वन्तरे अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्रीमहाविष्णवे नमः.
Good evening, everyone. We welcome each and every one of you. Before moving on to the session, let's welcome our eminent faculty, Dr. Rahul R. Nair. He took his BAMS from Vaidyanathan P.S. Warrior Ayurveda College, Kottakkal, and MD in Yoga Nidanam from Pariyaram Government Ayurveda College, Kannur. Currently working as Assistant Professor and Head, Department of Yoga Nidanam and Vigrudi Vijnanam, Specialist Consultant at Teaching Hospital, Ashtangam Ayurveda Chikitsalayam, Palakkad. Senior Visiting Specialist, Sidaram Pharma Specialty Clinics, Palakkad, and Medilife Polyclinic, Kutanad. Worked as tutor in Department of Kriya Shariram, Amuda School of Ayurveda, Assistant Professor and Consultant, MVR Ayurveda Medical College, Kannur, Evaluator and Examiner for University of Kannur and Kerala University of Health Sciences Graduate Examinations. He tries to explore the vast potential of Ayurveda in providing solutions for spectrum diseases like cancer, autoimmunity, pulmonary and cardiac disorders. We honorably invite you, sir. The dais is yours.
Leakage, endothelial leakage. There will be one branch is proceeding towards Shobham. Dosha Bhaga is not happening. Rapid Dhadu Bhagam is happening. There is destruction of Rakta. There is a destruction of the metabolic pathway which creates the Rakta. And a new entity called Rakta Pittam is being formed. Rakta Pittam means there is Ushna Drava Guna Varthida Rakta. You see. So, Charaga correctly states that Tasyoshmana Dravor Dhadu Thador Dhadu Prasichade Siddhyadastena Samruddhi Huyastat Adigachadi. When Rakta Pitta happens, here the concept of Upadrava is also coming in. Upadravastu Khalu Yogasrayo Roga Eva. It is also told that Upadrava is due to the presence of a predominant dosha at the time of onset of a particular disease, due to the effect of the predominant dosha. It is due to the presence of that particular dosha, which is highly vitiated, that it runs the disease and creates a new disease. So, in that particular case, because of the presence of a predominant pitta in Sanipadika dosha dushti, gradually an upadravam called Rakta Pitta ensues. And because of Rakta Pittam, the patient succumbs. And there will be attending Shobha Samprapti. So here, 3 Sampraptis have to be taken into consideration. Jwara, the Samprapti going on, Rakta Pittam can ensue, Shobham can ensue, and hence Dhadu Bhagam will continue, Dosha Bhagam will not happen, Rakta Dhadu is specifically destroyed, and hence the patient dies. The management principle is one important slogan from Ashtanga Hridayam comes to our mind when we manage dengue, hemorrhagic fever, or shock syndrome. Here, Ushma Pitta Drade Nasti, Jwaro Nasti Ushmana Vina, Tasmad Pitta Viruddhani, Tejet Pitta Adige Adigam. So, from initial attack onwards, Pitta Shamanam, yet Dosha Padanam shall be the approach. Is there any contradiction? Pitta Shamanam, yet Dosha Padanam. So, create Dosha Padanam, we require Ushna. Now, but the dosha here is Pitta. How will you manage this? So, for that, Tikta Padana Aushadhi, which is having Tikta Rasam, yet having Shida Viryam, yet having a Padana Guna in that, is sufficient to create dosha padanam, but it will not create provocation of pitta dosha. So the Shadangam Pana, Ghanachandana Sundiambu, Parpadosira Sadhidam, Sidam Pepyo Hidam Toyam, Pajanam Krit Jwarapaham, Pepyo. One important term points towards Ushnamevam Gunatvebi, Yunjat Naiganda Pittalai, Udrikta Pitte, Devadu, Daha Moha Adisara Karini. So, in that way, those Jwara in which there is an increase of Pitta, in that cases, you have to go for Pajana by using Shadangam Pana. It is correctly indicated in Jwara Chikitsa. Also, in the initial phases, Amrudotram Kashayam, Vyakhyadi Kashayam will be wonderfully working. Then there is Gopi Chandranadi Guliga, Sudarshanam Guliga. All those focusing on Pajanam, yet they are having a control over Pitta Dosham. If the respiratory problems are superseding, Lakshmi Vilasarasam will be good. And Sudarshana Churnam, if there is profound Pittadikam. Sudarshana Churnam is Tiktarasam. It is having Rejana function. It is advised to give Sudarshana Churnam in cold water. And Sudarshana Churnam is Sudarshana Churnam, if given in Shadangapana, is the best choice for reducing the predominant Pitta. If you suspect DHF, DSS, etc., introduce Vasha Guluchi Kashayam, Masha Guluji, Trifala, Katvi, Punimba Nimbaja, Kathak, Shaudri Yuto Handi, Pandu, Pittasra Kamala. So, Pittasra, Rekta Pitta, which can lead to hepatic disorders like hepatomegaly or Kamala, likewise. And also, it can lead to red cell destruction resulting in anemia. All that can be managed by giving Vasha Guluchadi Kashayam. Also, Drakshadi Kashayam will be useful, which is mentioned in Vada Pitta Jwaram, which I have not mentioned here. In order to put an end on the Rakta Dhadu Dushti, Manjishtadi Kashayam mentioned for Vada Rakta, that is Manjishta, Trifala, Tikta, Vaja, Daru, Nisha, Murda. Vaja, except Vaja and Daru, all the other are Tikta Pajana Ushadis. They are Sida Virya, but they are Pajana in nature. Vaja and Daru are Ushna Virya, but they are being scaffolded in another set of drugs, which is not harmful. So, Manjishtadi Kashayam, which is Vadarakta Samana, also which is having a good effect on the Rakta Vahasrodas, as well as Punarnavadi Kashayam, Navadi, which is having an impact on Shobham, Pandu. All those can be employed here to prevent the ill effects of Shobha Samprapti happening here. Arthavilyam Kashayam is also another good choice over here. Chandraprabha Guliga, which contains Shilajadu, which is Shida in nature, yet Pajanam, yet Chedanam in nature can be given here. Also, Pravala Bhasvam Rasasinduram combination is also giving good results. And after initial attack, when Jwara, and also I will say, if DHF is happening, you can have Kachuradi Churnam for Talam. And also you can employ Suvarna Muktadi Guliga along with the honey. That 2 points I have missed in slides. That is use of Suvarna Muktadi Guliga, use of Drakshadi Kashayam, use of this Kachuradi Talam. All these will be having an effect on the Samprapti, the fast progress in Samprapti. So when Vada and Pitta are involved in some Sampraptis, that Samprapti will start fatal very fastly. So to reduce the pace of Samprapti, you have to give the drugs like this, Suvarna Muktadi. And also Mahalakshmi Vilasarasam, which contains gold, is also effective in reducing the pacing of the Samprapti. And then after initial attack, when Jadarakni and Dhatukni is still in a Vishama Avastha, it is good to go for Indugandham Kashayam. Thereafter, once attaining stability, go for Chavanaprasam and later Pittaka Kridam in small doses to reduce the ill effect of Pitta, so that if a next attack happens, that should not lead to hemorrhagic fever or shock syndrome. This protocol will be good for such patients. So this much about the approach to dengue fever. I may say this is not a complete approach, because a lot more equipments are there in our Samhitas. So what I am trying to tell is that we can derive certain protocols for dengue fever by placing the Jwara model as well as the clinical entities like dengue hemorrhagic fever, dengue shock syndrome, etc. And also we brought the components of Jwara Samprapti, Raktabita Samprapti, Shobha Samprapti for managing this dengue hemorrhagic fever and dengue shock syndrome. And then chikungunya. Chikungunya also caused by a virus which belongs to the same family of arthropod virus group. Sudden onset of severe joint pain which cripples the victim. Symmetrical polyarthropathy is there. And the interesting fact is that in Kerala, when in 2008-2009 time, when there was a rapid advancement of chikungunya fever, it was the first time that in Kerala government has agreed to use Ayurveda widely for prevention and treatment. So not for prevention, for treatment of this particular illness. And we have seen that those patients who have taken Ayurveda has very little residual polyarthropathy. Chikungunya, one important feature is that even after the subsidence of fever, many patients will be getting a residual polyarthropathy not only for months, it may last for years. And it can be explained similar to our concepts of Dushi vision, wherein we were getting after, I think from even up to 2018, we have seen cases coming to our OPD, especially during rainy season, with the increased swelling, difficulty to walking, etc. Those were patients who were affected with the chikungunya and escaped from that 10 years back. So there was a long-standing residual polyarthropathy, and especially in patients who used Ayurveda, this residual polyarthropathy was very minimal. So actually, chikungunya episode, I may say that at that time of attack, we were given a lot of support from the government to use our medicines to counter the ill effects of chikungunya. So that reduced a lot of fatality and morbidity to the patients. And here, sometimes rarely hemorrhages CNS symptoms may happen, and sometimes the patient may die. Widely seen in Asia, Africa, and Middle East. And 1964, there was a big outbreak, big massive epidemic happened in Tamil Nadu that has been well studied. Even serological studies were carried out at that time in Madras. And in 2004 to 10, different outbreaks of chikungunya happened in Kerala. Vectors are the same. Incubation period is 2 to 10 days. Abrupt fever with a chills, rigors, headache, joint pain may happen. Mild conjunctivitis and pharyngitis. One J is missing there. Severe inflammation of joints may happen. Standing, walking becomes excessively painful. Symmetric polyarthropathy, sparing shoulders and hip. Small joint of hand and feet affected. And I still remember in OPDs, the patients who are having preoccupied wear and tear of the joints, who are long-standing daily wage workers, who are having some joint problems, degenerative joint disease. Also, those people who are very much fatty, non-exercising, above middle age with a lot of degeneration in their joints. For them, the chikungunya attacks were very severe. Their arthropathy were very severe. Pain is excruciating, hence crippling. The patient may be crippled to bed because of the severe pain. Fever and joint pains may start subsiding by the 6th day. Residual also arthropathy may last for years. There will be severe morning stiffness. The progression is generally benign, but slow recovery only happens. So there will be a lot of loss of working days. The patient may be crippled to the home. He cannot go out, take a vehicle, or get into the bus and do the routine activity. All the activity will be affected. Polyarthropathy may persist, may mimic many times with rheumatoid arthritis. So it was during these past 10 years when people came with the complaints with the multiple joint pain, especially small joint pain, morning stiffness, etc. The usual question in Kerala's OPDs were whether you have any past chikungunya-like fevers. Any viral fever with the joint pain might have happened in your life previously? That was a very usual question. It may turn fatal for infants and very elderly people. At that time, when chikungunya was very at its peak in Kerala, every day in newspapers there was mentioning about people who died due to this disease. The only technique to identify this was IgM antibodies against the chick virus for serological diagnosis. The rest was clinical diagnosis. When you get a patient with swelling of joints, pain of joints, difficulty to walk, crippling, morning stiffness, small joint affliction, polyarthropathy, all these combined together to give a diagnosis of chikungunya. And the Ayurvedic approach, usually this can be correlated to Vada Pradhana or Vada Kapha Pradhana Jwaram. Why I say Vada Pradhana Jwaram? Why? Because of the different type of pain features. When you go to the text and see the sloga of Vadiga Jwara, Agama Abagama Kshoka, Mrududa Vedanoshmana, Vaishamyam Tatra Tatrangi, Tastasyur Vedanaschala, Padayo Suktadastamba, Indigo Dveshtanam Jwara, Visleshaiva Sandhinam, Sada Uru Kadigraha, Prishtam Kshoda Mivapnodi, Nishpidya Daivodara, Chidyan Daivachastini, Parshagani Visheshada, Hridayasya Grahastoda, Prajaneneva Vakshasa, Skandayor Madanam, Bahor Vedaha, Pedanam Amsayo. In this way, a lot of pain features are being mentioned specific for each joints when you describe the Vadiga Jwara. So, many features may be floating towards Vadiga Jwara or Vada Pradhana Kapha Anubandha Jwara. Such features may also be seen in many patients. And it may turn into a Sanivadiga Jwara at any time. Because when the patient is getting into severe body pain, loss of sleep, occasional sweating, reddishness, lacrimating eyes, all point to a turning into a Sanivadiga Jwara, wherein the patient slowly shift into from a Vada Pradhana Avastha to Vada Pitta Kapha Pradhana Avastha. Be careful if host factors are not favorable. Many a time, these infective fevers happen. We will read a lot about the guest factors. That means what about this virus? What is their incubation period? How is getting spreading? And after spreading, what should be the test to identify? And all these factors are good. But for us, we have to focus on, turn our torch also into the host factors. If host factors are not favorable, why I am saying this? In Kerala, there is a approach of managing the lifestyle diseases by using allopathic medications. So many a time we have seen that the allopathic medications for lifestyle diseases are given free of cost from the primary health centers. And hence the patients are more medication dependent to manage the lifestyle disorders instead of changing their lifestyle. So those persons who are having a previous history, a long-standing history of diabetes or hypertension, previous history of myocardial infarction, COPD, dyslipidemia, hypothyroidism. So all those categories of patients are having unfavorable factors when such Jwara happens in the body. So such patients will be crippled more fastly if they are obese, if they have got degenerated joints. All these tend to bring them fast into the bed when this chikungunya happens. And in Vada Pradhana or Vada Pradhana Kahanubandha Avastha, the target is to counter the Vishama Avastha, accelerate Dosha Pajanam, open up the Rasa and Svedavaha Srodas. Ushna Pajana Drebya, yet maintaining the Ojo Guna is advisable. So, Indugandam Kashayam, Vadamaya, Shaya Mahodara Kulmasula, Nimnoanada Jwaraharam, Belavarthanam cha. So, the Bela is to be maintained at any cost in any type of Jwara as per Ayurveda. So, Belavarthana, Nimnoanada Jwarahara Kashaya is Indugandam Kashayam. So, Indugandam Kashayam was used very commonly when we were having a chikungunya episode. Also, the Dashamula Gadatrayadi Kashaya, which is focusing its therapeutic target on different types of joint pain along with the Urthvanga Doshavastha. That is also the Dashamula Kadatraya. Sama Samulakadatraya Vasha, along with Vasha, along with the honey, you have to give this Kashaya. Swasana Anila Kasa Parsha Prishta Triga Murtha Rujasu Sambradishta. So, in cases where there is Samadosha residing in different joints, creating different pain features, Dasamula Gadatrayadi Kashaya was having good therapeutic use. Dasamula Panajaram as Marma Samrakshanam can be given. Vettumaran Guliga, Vada Gajangucharasam, both for reducing pain features is good. And for residual polyarthralgia, we used to give Rasna Saptagam Kashayam, Vettumaran Guliga, Shatkarnam Churnam, Manjishtadi Kashayam. Rasna Saptagam is a wonderful combination in that it is having Rasna, which is Vedana Haratum, Amrudha, which is having a potential effect on Rakta Pitta Samanam, Devadari, which is Pajanam, Trigandagam, Erandam, Punarnavam, all those are Anilomanam, Shobhaharam, and in that we are adding Shundi Churnamas Prakshevam, which is excellent Pajanam, which is Kadu in Jasam, Madhuram in Vipagam, yet Shobhaharam. And so that's a very wonderful combination that can give good results in residual polyarthralgia. And also there is Shattarnam Churnam, Manjishtadi Kashayam, Dasamura Gadatrayadi Kashayam, Indiganam Kashayam, Punarnavadi Kashayam, all those were wonderfully used in residual polyarthralgia. Also, Gugulu Galpanam, Saptasarang Kashayam, Sahajaradi Sataila Kashayam in later stages only. On initial phases, we were not administering any Taila internally, but on later stages, if we are very much confident that Amavajanam has happened, in that stages, Sataila Sahajaradi was used. And Agastya Rasayanam as a drug which is having good effect on this type of Vata Kapha Jwara Avastha or such type of Jwara where there is persistent Rasadushti was happening. So to make the Dhadus more Belya, in later stages when Amapadanam has happened, Agastya Rasayanam was a good choice. In IPD, if you get a patient with residual polyarthralgia, due to this Chikun gunya, Vasti protocol with Dhanyamla Vaidaranam, Madhu Tailiga, all those were sequentially administered in a patient. Then Dhanyamla Segam for initial period, followed by Avikiri with the Koilagulathadi Churnam, which is heated from the steam of Dhanyamlam was employed. Thereafter, Patra Podaras Vedam with in a Ruksha way, then followed by Snigdha way of Patra Podaras Vedam. Appropriate Lebanam at joints were provided. For example, if there is Vadagapha Avastha, we will be giving Nagaradi Leva Churnam or Grihadumadi Leva Churnam. When there is Pittani Bandhitam, Rakta Dushti, etc., Jadamayadi was given or Guluji Patradi Levanam was given. So, in that way, in IPD, we used to manage the patients. And coming to the another disease called influenza, or the other term, it is flu. Very common viral disease presenting as an acute febrile illness caused by influenza A, B, C virus. There are three human subtypes, H1N1. We are very familiar with the term H1N1, H1N2 and H3N2. These three subvarieties are seen. Continuous assortment of genetic material between subgroups, a very notable point. Why you cannot develop a continuous effective vaccine against this influenza virus? Why? Because of continuous assortment of genetic material between subtypes and formation of new strains happening. So vaccines may turn ineffective anytime. So that's a very important message to us. We should focus on the guest, rather giving more importance on guest factor, we have to focus on the host factor. It spreads by droplets, aerosols, which can land in eyes, nose, or mouth of another person within 1 meter. Some interesting facts. Before COVID-19, if you want to visit US or some other places, you have to mandatorily take flu shots, the vaccines.